What's up, Hoopers? We're gonna go over why basketball players should be using a slant board. My name is Dr. Marco Lopez, Doctor of Physical Therapy and co-founder of the Basketball Doctors. So today we're gonna go over why basketball players should use a slant board for certain exercises. So a slant board is anything that elevates your heel. So sometimes we use a plate or anything, but often you see a lot of basketball players using this when they're doing leg exercises like a squat, a single leg squat, or a step down. And the reason we're gonna do this is because of several things. So one of the things you wanna use this for is for your ankle mobility. So a lot of basketball players don't have the adequate ankle flexibility. So whenever they do a squat, they come and their heels are off the ground. So this slant board, when you do a squat, will give you more mobility. It'll put you more in plantar flexion, so you don't have to have too much dorsiflexion. So when I do the squat now, I'm able to go as low as I can because this slant board is lifting up my heels. But when I do it as opposed to without a slant board, I'm not having my heels elevated, so that increases some instability. So here, when I do this exercise, I'm able to go further down in my squat, work on that hip mobility, work on that quad strength. So that's one of the reasons. So to kind of recap, one of the main reasons why we use a slant board for basketball players is because sometimes they don't have the adequate mobility in their ankle. So that's gonna allow us to do a squat more efficiently because we'll be able to go deeper and more positional that we want to be in for basketball. Another one is it's a great tool for jumper's knee rehab. So when we talk about jumper's knee rehab, we're talking about tendon tolerance, improving that capacity of that tendon. If you want to learn more about jumper's knee, click the link above. We have a whole series on jumper's knee. But the big thing that we talk about is you're not supposed to be resting jumper's knee, you have to be loading that tendon. One great way to load the tendon is using a slant board. So the slant board, as we talked about, it's gonna take out that ankle. So now we don't have to worry about ankle mobility. Two, it's also gonna decrease the use of the calf muscle. So right now, we're gonna be using more of the quad. So when I do this exercise, I'm gonna try to keep my chest up and I'm gonna lean forward, allow my knee to go literally slightly past my toes and then come back. Because my chest is more upright, when I do this, I'm gonna be able to load the tendon and the quad a little bit more than if I would do it without it. So if I do it without it and I try to reach out, I have to sit back a little bit more because of mobility deficits. So this slant board is gonna allow me to load that patellar tendon more than without it. Because one, like I mentioned, you're gonna take out the mobility of the ankle, so you don't have to worry about that. Two, you're gonna take off the activation of the gastroc, the calf muscle. And three, you're gonna be in this position where you could keep your chest more upright and able to really get more of that quad working there. So those are the two main reasons why I tell people to use a slant board. So one, to help improve your lower extremity exercises to take out that dorsiflexion range of motion limitation. However, we don't want to always use this. We want to use this early on as we're working on that ankle flexibility, then progress to not using it at all. Number two, for jumper's knee rehab, like I mentioned, we need to improve the tendon strength. So one good way is those decline squats here, and we're gonna allow ourselves to load that quad and that tendon without using contribution of our glutes or our calves. So those are the two main reasons why you gotta use a slant board. Like I mentioned, guys, it's a great way early on to load those muscles without worrying about mobility deficits, but you still have to be working on your mobility. But this is a great way as you're working towards your mobility. Hopefully you liked this video. Hopefully you learned a thing or two. If you did, hit the like, share, subscribe button, share this with friends and family. And we are the Basketball Doctors. Let's ball for life.